Every day, children accidentally injure their mouths and teeth. Injuries can be as simple as bumps and scrapes or as dramatic as knocking out a tooth altogether. Knocking out an adult tooth is a real emergency, and here's what you need to know and do. The tooth will have the best chance of survival if it is replaced quickly. This is ideally done within a few minutes. To do this, hold the tooth by the crown, not by the root. Clean it under running water and push it back in its socket. You shouldn't touch the root as the cells covering the root are very delicate. Once the tooth is back in place, bite down on some clean fabric or tissue and go to the dentist straight away. If you can't get the tooth back in, put it in milk and get to the dentist immediately. Try to call the dentist on the way to let them know to expect you. Never replace a baby tooth that's been knocked out. If in doubt, put the tooth in cold milk and get to the dentist immediately. As a guide, it's useful to know that most children don't have any adult teeth until 6 years of age. For most other dental injuries, like fractures and minor displacements, there's no immediate first aid required, but you should give your child pain relief if they need it and call your dentist to arrange to see them as soon as possible. Baby teeth and adult teeth that have been dislodged a little can usually be gently pushed back into place by your dentist and are sometimes held in place with a splint or brace. Broken teeth can be fixed with a filling material, and if the inner layers of the tooth are exposed and sensitive, treatment can be carried out to keep the tooth healthy. Seeing your dentist within 24 hours is usually fine for these kinds of injuries. Cuts and scrapes to the lips and gums are quite common. Bleeding is usually controlled by applying pressure with a clean piece of damp fabric or tissue for 5 minutes. Make sure your child wears a mouthguard and an appropriate helmet for sports such as hurling, camogie, rugby and boxing, and a helmet for activities such as cycling, skating and scooting. Custom fitted mouthguards offer the best comfort, fit and protection. Frequent dental visits from an early age provide you with the opportunity to discuss oral health issues that are important for your child. Most people don't know that dentists recommend that you bring your child for their first visit by their first birthday. It's always good to start early to get the best advice possible.